welcome back. So now let us discuss about the different functional areas on the superolateral surface of the cerebral hemisphere. So as you all know, the cerebral hemisphere, each area is designed for a specific function. So that is why Broadband has divided the areas into few different areas basing on the function. So these are referred to as the Broadband's areas. So Broadband's functional areas. So in this video, we will have a look at all the functional areas on the superolateral surface. So first, let us have a look at the frontal lobe. What are all the functional areas in the frontal lobe? So in front of the central sulcus, we have got area number 4. Area number 4. So this is associated with the motor area. So this is referred to as the primary motor area. So the motor cortex is otherwise area number 4. So this is the area from where our pyramidal tract or the corticospinal tract will begin. So this extends on to the medial surface as well around the paracentral lobule. So this is the area number 4 and this is the primary motor area. So all the motor activities which we do of the skeletal muscle, all our voluntary motor activities are under control of this area number 4. Next is area number 6. So in front of the precentral sulcus, in the posterior part of the superior frontal gyrus, you have got area number 6. So this is called as associated motor areas. So overall, if you see in the cerebral hemisphere, we have got motor areas, sensory areas and association areas. So this associated motor area is the area from which all the extrapyramidal tract fibers will begin. So you won't have the giant bed cells in this area. So this is the place from where the extrapyramidal tracts will begin. Next, coming to the other area. So that is area number 8. Area number 8, it is present in the posterior part of the middle frontal gyrus. So this is called as frontal eye field. So frontal eye field. So this is responsible for the conjugate movements of the eye. So this is connected with the visual cortex by means of association fibers. And then the other area in front of this frontal gyrus, so is 9, 10 and 11. So this is referred to as the prefrontal gyrus. This prefrontal gyrus is the one which is responsible for all the psychological activities, for the judgment, for the social behavior and for all the emotions which we show. So those are all dependent on this prefrontal area. That is area number 9, 10 and 11. So in the lower part of the inferior frontal gyrus, we have got an important area, area number 44 and 45, and this is referred to as Broca's area. So this is otherwise called as motor speech area. So the fluency of the speech is based on this area. So if this area is affected, patient will have a motor aphasia. So he won't be able to produce the speech. So this is located in between the ascending anterior limb, horizontal limb and ascending limb of the lateral sulcus. So the area in front of the horizontal limb of the lateral sulcus is called as pars orbitalis, and the one which is present between the horizontal limb and ascending limb of the lateral sulcus, this area 44 is called as pars triangularis. So this is the one which forms the Broca's speech area, area number 44 and 45. So those are all the functional areas in the frontal lobe. Now let's have a look at the parietal lobe. So you must have understood frontal lobe is mostly concerned with the motor activity. So it is also called as motor cortex, mostly motor. And behind the central sulcus, we have got the parietal lobe and it is mostly concerned with the sensory areas. So it is sensory cortex. So behind the central sulcus, this is the parietal lobe. So you have got one more post-central sulcus and in between that you have got the post-central gyrus. So this is given areas number 3, 1, 2. Areas number 3, 1, 2. So this is referred to as the somatosensory area. So all the sensory sensations like pain, touch, temperature, all these will relay in this sensory cortex. Even our taste sensation also will relay in this sensory cortex. So that is primary somatosensory area. Next, in the superior parietal lobule, you have got areas number 5 and 7. So these are associated sensory areas. So these areas, they are mainly concerned with the stereognosis. That is, you are able to identify some object which is kept in your hand with your eyes closed also. So that perception is called as the stereognosis. And then other things which you see in the inferior parietal lobule is areas number 40 and 39. 39 is partly present in temporal and of course in the parietal lobe, but 40 is present in the parietal lobe. So 39 and 40, they are referred to as Wernicke's speech area. So in the frontal lobe, I told you Broca's area, that is concerned with motor speech area. This Wernicke's speech area is concerned with the sensory speech area. So this is called as sensory speech. So the speech which we are talking, if it has to be understood and if it should make sense, this Wernicke's speech area should be intact. If you want to produce speech, the motor area should be intact. If you want to produce a sensible speech, the Wernicke's area should be intact. So this is the Wernicke's speech area, that is area number 39 and 40, Wernicke's speech area. Next, coming to the different functional areas in the temporal lobe. So in the temporal lobe, in the superior temporal gyrus, we have got area number 41 and 42. That is also referred to as Heschel's gyrus, and this is the primary auditory area. So the auditory pathway, if you see, finally it will terminate in this primary auditory area. So this is associated with the hearing. And just below that you have got area number 22, that is the associated auditory area. So secondary auditory area also. So that is the important functional areas which are present in the temporal lobe, and of course 39 is partly present in the temporal and parietal lobe, I told you. So part of the Wernicke's speech area is also present in the temporal lobe. And next, coming to the functional areas in the occipital lobe. So we have got areas number 17, 18 and 19. So area number 17, it is primary visual area. So the one which is concerned with the vision. And then we have got 18 and 19. So that is the associated visual areas. So 17 is referred to as the primary visual cortex. So in total, if you see, the frontal lobe, it is related to all the motor areas and frontal eye field and to the prefrontal cortex. And the parietal lobe, it is related to the sensory areas, somatosensory and associated sensory areas and Wernicke's speech area. And the temporal lobe is mainly concerned with the auditory cortex, and the occipital lobe is concerned with the visual cortex. So this is about the different functional areas in the superolateral surface of the cerebral hemisphere. So in my next video, we will discuss about the functional areas in the other surfaces.